As the nurse manager of the Ambulatory Surgical Center of Stevens Point, I would like to thank you for having your surgery here at our surgical center. The purpose of this video is to help you prepare for your shoulder surgery. There are some things that you can do ahead of time to help in your recuperation period. It is sometimes the simple things one doesn't think about that can really make a difference. We hope you find this information useful.
Hi, my name is Pete. I'm a nurse at the Ambulatory Surgery Center of Stevens Point, and I'm also a former shoulder surgery patient, and I would like to speak to you today about preparing for your surgery, upcoming surgery, things you can do before and afterwards to make life a little easier for you. Let me start talking about preparing your home environment. There are a number of things you can do ahead of time to make it easier on yourself when you do get home from surgery. Consider moving objects that you will need in your pantry, in your kitchen, in your bedroom, or wherever in your home that are currently above your shoulder height. Because when you get home from surgery, you're not going to be able to reach above shoulder height. Consider handrails in your bathroom or bathtub. Those can make things considerably easier for you too. Chair height is an issue. You might want to place blankets on a chair to raise it up so that it is higher and easier to get in and out of. Also, clutter around the home, such as electrical cords, throw rugs, things like that you might want to consider removing so that it's just easier to get around once you're home from surgery. Ice is our friend afterwards, after surgery, post-operatively. You will want at least 4 ice packs that can be exchanged every 20 minutes to a half hour. You may want to prepare some frozen meals or buy some frozen meals for afterwards. You are not going to be able to drive after surgery, so a friend or a relative is going to be very helpful to bring you into your doctor's appointment or physical therapy. Okay, let's talk about sleeping positions. Sleeping is not going to be the same after surgery. You may find it very uncomfortable to try and lay down, so I highly recommend a recliner. If you have a friend or a relative who has a recliner, or if you can obtain a recliner, it would be very helpful in your recovery period. If you decide to sleep in a bed, you're going to need lots of pillows to prop up behind your back to get you in a comfortable position, because you are going to be in a sling or a shoulder immobilizer, and it can be tricky. And now we'll talk briefly about personal hygiene.
Hi, my name's Kitty. I'm a nurse at the Ambulatory Surgical Center, and I'm going to add to a little bit of the tips for preparing yourself for shoulder surgery. After surgery, it's going to be difficult to clean yourself up and prepare for hygiene. Brushing your hair, I would suggest that you practice before surgery and see if you can do your hair pretty much with the non-operative arm, if you're used to using the operative arm, as well as your teeth. You just really want to remember that you need to keep that shoulder within the limits and the restrictions that your doctor prescribes for you. So practicing is going to be a big help. You could also consider getting your hair cut before surgery, and it might help manage it. Okay, then after surgery, it's going to be a little bit more difficult to get yourself dressed. So you want to try and think about that before surgery. Elastic waistbands are great. Slip-on shoes, Velcro shoes, belts and buckles are difficult with one arm. Also button-down shirts. You can use a gravity method by hanging your surgical arm down and pull the sleeve up, and then wrap it around with your good arm. One of the things you want to make sure you're prepared for is pain. If you have prescription for pain medication prior to surgery, it's important that you get that filled before you come for surgery. The other thing you might want to consider is ask the pharmacist if they have some caps that are non-secure or non-child-proof, so it's easier for you to open them because you'll be limited with your surgical arm. Following surgery, we will send you home with an ice pack, and it will look like this. We'll put it in a sleeve like this. So we suggest that when you take it home, take it out of the sleeve to put it back in the freezer, but you might want to consider getting extra ice packs because you're going to have it on for 20 minutes, then put it back, and it might not freeze back up right away. So you can prepare by getting extra ice packs, but just make sure that you have something between your skin and the ice pack, some type of barrier.
So hopefully you found these helpful hints valuable as you prepare for your upcoming surgery. Thank you for trusting us with your surgical care.